Yes. Now, so good afternoon once again, and I'm going to go ahead and get started. All right, just as we take a quick look at our meeting topics for today, we're going to do a regional update on the coronavirus cases, confirmed cases in the region. All right, we'll do some updates from the previous meeting. We'll get some updates. I'll read off and discuss some updates from the Office of Head Start, and then we'll have a presentation from Carla Debnam, who is from the Renaissance Center, and she'll be talking with us about looking at re-entry and how to make our staff feel, or help our staff to feel comfortable coming back to the center. So as we take a look at our cases, confirmed cases in the Washington, D.C. region, right now they're at 39,961 cases, just about 40,000 cases. All right. There are 4,110 in the district, 14,986, just about 15,000 in Virginia. And then there's 20,865 in Maryland, just about 21,000 in Maryland. And you can see the death toll underneath those. I always get a little bit uncomfortable reading the death tolls. So you can see it there on the screen. All right. Those are the current cases in the region. And of course, that number continues to climb. And we are, we'll continue to watch it, monitor it. A few updates from the previous meeting. Cleaning supplies and PPE. There's been a lot of discussion in Maryland, of course, around the region and nationally about getting cleaning supplies and PPE. I was on a call this morning with the Office of Head Start, Region 3 Office of Head Start. There's more discussion about it. People have been sharing some resources. I was on a call yesterday with the National Head Start Association. They're trying to pull together as many resources as they can. OCC is aware of the situation. I have met Yvonne, and I had a meeting just late last week with a company called Food and Supply Source. And they do have sources for to purchase cleaning supplies and PPE. Okay. Now, we're hoping to connect with some people that can try to get us some things a little bit more immediate than Food Supply Source can. All right. So we're still reaching out to places. I do have a meeting set up with School Health to see what they can provide to us and how they can help us out and provide us with some resources. And I'm continuing to reach out to larger corporations like the Safeways and ShopRite Company and some other places to see if they can help provide us with cleaning supplies, also PPE, to see if we can possibly get some of these things donated to us. I know there are a lot of companies around the state now, there's a company right where I live that produces candy. They usually make candy. Now they're making hand sanitizer. And there's other companies that would normally make alcohol beverages, and they're producing hand sanitizer. So we're going to try to reach out to some of those companies to see if we can get them to, help out Head Start and child care programs. All right. Now, this one company, Food and Supply Source, and I will send you information so that you can take a look at them. And Yvonne and I, still kind of vetting them, to make sure that they're good. They work with other Head Start programs across the country. I don't know if anyone here in Maryland has worked with them. If so, please let us know what your experience with them is like. All right, I'm going to share this screen for just a second, and I accidentally paused my sharing. Didn't mean to. But let me share with you. Let me get this back up on the screen first. All right, I want to share with you what their, just some of the things that they have, if I can get it up on the screen. And maybe I won't be able to get it up on the screen now. So if I'm not able to get it up on the screen, then I'll just send it to you. But, they have all of the PPE equipment that you could ask for. They have face masks, different types of face masks, of course, hand sanitizers, um, face shields. I'm not sure if we're going to need face shields. They got surgical gowns. They also have infrared thermometers that we can order. Infrared from thermometers, if you order about 50 of them, it's about $69.98 per monitor. All right, so I will make sure that I send this information out to you so that you can just take a look through it. All right, I believe School Health, and you may be familiar with School Health, they also have infrared thermometers and face masks and things like that. And I believe that these are going to be things that we're going to need as we talk about re-entering the classroom. We don't know what it's going to be like, and hopefully the Office of Child Care will give us some guidance about re-entering the classroom. I'm pretty sure they're working on that as we speak. All right, but at the moment, we're kind of, left to think about how things might go and what we should be doing to re-enter the classroom. But we have reached out to people, and we'll continue to reach out to people to see if we can get more cleaning supplies in. We're going to talk about re-entry a little bit later. Working to bring in trainers to these meetings here that are going to help you with your needs going forward, especially as we look at reentry. Like I said, Ms. Carla Debnam is here today to offer some, brief trainings. And she'll be back on a few other occasions, hopefully, to give us some more of her expertise. Region 3 Officer Head Start, they're going to join in on a few of our calls along with the TNTA network to assess our needs and see what kind of resources they can provide. And they may even come on and do a few webinars with us. All right, and we'll continue to reach out to other trainers so that we can, so that we can continue to bring in, bring trainings to you. All right, so I just ask that you continuously, while we have these trainings and while we're on these calls, let us know what your needs are. Let us know what kind of information you would like to come in and who we can bring in. And, what kind of people we can bring in to address those topics. All right, so we'll continue to look out for that. All right. Let me go to a few updates from the Office of Head Start. I don't know how many of you were on the National Live conference that the National Head Start Association had, but there were some updates from the Office of Head Start. All right, here's some of the main updates here that you need to be aware of. One, there is no end of the year PIR data being collected. There's going to be some kind of guidance that comes out about it or an official statement that comes out. But this is what we do know, is that there's no end of the year PIR data being collected. Clearly they're afraid that not all of the information can be accurately collected, with children not being in the classroom and so many people not in touch with families and so on. All right, so I don't know how things are going to move forward. I guess we'll wait for that guidance to come out. There is going to be guidance on re-entry that is forthcoming. All right, so we're going to look at the Office of Head Start's guidance on re-entry when it comes out. But of course, we're going to have to look at what our state and local requirements are by the Office of Child Care, which sometimes, we're going to have to look at both to see which is more stringent. So it's something that we're really going to have to pay attention to. And I don't know if Tressa has any updates on the Office of Head Start publishing guidance on, I'm sorry, not the Office of Head Start, the Office of Child Care publishing guidance on reentry. All right. Summer Learning Plan B. There will be some guidance coming on this Plan B in the event of ongoing closures, as it looks like there may be, some states that are still going to be closed. A lot of states that are still going to be closed. We don't know when that's coming out. I guess they're working on it now, and we don't know what that Plan B is going to be, but it's coming out, and it's something that they're going to work, that they will distribute when the time is right. The stimulus checks and unemployment insurance do not count towards income for eligibility. Now, I think, and we will get more clarification because there's going to be formal notice, but I do believe that when they're talking about the unemployment insurance, they mean the $600 that was included in the stimulus, right? The extra $600 on top of the family's unemployment insurance. So, like I said, there's going to be a more formal notice soon, and it'll explain it. But for the time being, that the stimulus checks and that unemployment insurance stimulus, if you want to call it that, do not count towards income for eligibility. And as soon as that guidance or formal notice comes out, if you haven't received it, well, I'll distribute it to everyone anyway, even if you have received it, just to make sure that you do get that information. Okay. So we'll look forward to some of these things coming out from the Office of Head Start. There was a document and information memorandum that came out today from the Office of Child Care. And I will see if I can bring this up. I'll bring it up quickly. And if you do not have it, I'll make sure that I send it to you. All right, but this information memorandum pertains to the Child Care and Development Fund discretionary funds that was appropriated in the Coronavirus Aid, Relief, and Economic Security Act, the CARES Act. All right, so and the purpose of it is to provide an overview and guidance on the supplemental CCDF discretionary funds that were made available. I will make sure that I send this out to you. Right, so if anything applies to you, you can pay attention to it, or if you have partners that it may apply to that have not seen it, you can make sure that you get that out to them as well. All right, so I'll make sure I send this out to you today. Let me get back to my screen. Nope, that's not the screen I want to get back to. Let me get back. I'm getting back to my screen here, I think. Oh, actually, that is the screen. Let me just get it back up. All right, there we go. Okay, so those are the updates from the Office of Head Start. Now, hopefully you are all aware, but Governor Hogan did release a roadmap to recovery. It's a 30-page document. If you do not have it, I'll make sure that I send it out to you, but it is something that you should pay attention to, just to see how the state will be opening back up. I'll say this, there is no timeline. All right, everything depends on the number of cases and when the experts there believe it is time to begin opening up, and it opens up in stages. but they will be basing the roadmap to recovery on 4 building blocks: expanded testing capacity, increased hospital surge capacity, ramping up the supply of PPE, and robust contact tracing operation. And if you go to the website, and the website is linked to our website, but on the website, they kind of have an update as to where we are in these areas. All right, so this here, what's up is the website. And you see is roadmap to recovery, Maryland Strong roadmap to recovery, and it shows the 4 building blocks. And you can see it says expanded testing capacity, and then it has the status as being on track. Increased hospital surge capacity, the status is ahead of schedule. Ramping up supply of PPE, the status is on track. All right, robust contact tracing, the status is on track. And it gives an explanation of each one of these areas. Okay. And then there's also along with the 4 building blocks, there's stages in which they plan to move. All right, and bring that over here. So they have 3 stages. The first stage is low risk. Okay, this is the first stage of recovery, and it involves businesses, community, religious, and quality of life improvements. Once the governor determines that Maryland has a sufficient foundation using the building blocks and other benchmark metrics, the governor will announce that Maryland is moving to this initial recovery stage. Now, the stage is going to be rolled out over a period of time using the White House protocols that were released maybe last week. All right, and then there's medium risk. All right, this will likely be a longer stage of the initial recovery, but will also be the stage when a large number of businesses and activities come back online. Any business that reopens during this period would need to comply with strict physical distancing and appropriate masking requirements. The stage includes numerous steps over many weeks towards recovery. And then the third stage, and I didn't put it up here, but it's high risk. Excuse me for the typo. And these are more ambitious and long-term goals. There's no realistic timeline yet from any of the scientific experts for achieving this level, as this requires either a widely available and FDA-approved vaccine or safe and effective therapeutics that can rescue patients with significant disease or prevent serious illness, and those most at risk to reach a full return to normal conditions. The Commerce Industry Recovery Advisory Groups will submit safe reopen plans for each sector of the economy designated as high risk for COVID spread. The plans will be carefully reviewed and vetted by our Maryland Strong Recovery team to determine if it meets both public and health commerce needs. All right, like the medium risk, the high risk stage will also have sub-phases with capacity restrictions and gating. All right, so you can read this entire roadmap to recovery on the website, and I'll make sure that it's linked to our website so that you can take a look at it. All right, and I'm bringing it up now. This is the 30-page document that was published. And you can take a moment and read through that yourself, so that you can get all of the details, right? And so I'm assuming with this document being published that the Office of Head, I keep saying Office of Head Start, the Office of Child Care is also working on some guidance to child care programs recovering. All right, so we'll be looking forward to that. If you get a chance, please make sure you take some time and take a look at that. All right. Um, so from here, reentry is obviously going to be on the horizon at some point. So we really do want to take a look at reentry, and when all of these guidance comes out, I'll make sure that you get it. In a moment, I'm going to bring up Ms. Carla Debnam. But before then, I want to first find out if Tressa would like to add anything to the conversation. As soon as I can find Tressa here we go. If Tressa would like to add anything to the conversation, and if Yvonne would like to add anything to the conversation.
Hi, everybody. Just to give you a little update on the Head Start state supplemental funding. We've gone over it's continuation grant, so we've gone over the application and tried to simplify it so that it's much easier to fill out. We're trying to put it in line with other things that we're doing. So in any way, you can look at the statewide system development goals and see how it fits into that, which is strengthening availability and access, improve and support program quality, ensure successful transitions, deepen family engagement, and expand and enhance workforce development and improve systems for infrastructure. So as we move forward, I think we've mentioned before that your new grant's going to run from July 1st through September 30th of 2021. Your current grant goes through September 20th of 2020. So if you have other funding to have summer, or if the summer doesn't work, the current funding that you have that ended September 30th can be expanded to December 30th. And you can look at some of these other development goals and think of other ways, if you're not going to have summer support, some other ways that you could use that money. So I'm thinking of something like ensure successful transition experiences. So maybe if the kids don't have summer program, you could do some kind of visits or do some videos or do something that helps them transition into public school and use the money from this to work on videos or the teachers visiting or whatever would be useful to your programs. So that's the one update I wanted to get to y'all. Any questions or anything?
And if you do have questions, I am unmuting folks now, so you should be unmuted. If you have questions, you can go ahead and ask a question.
Hi, this is Mary Gunning. I just had a question. I'm on a call, so it may be up on the screen, but can you send those goals out to us?
Oh, sure, I can do that, Mary.
Okay, thank you.
Yeah, they're kind of cool.
Any other questions on anything up to this point? Okay, well, if you have questions as we move forward, you can put them in the chat. I do want to let you all know, just going back to the food and supply source company that I was talking to you about, they also offer, they will review your food and your food cost at no charge. Of course, that's something, going into the future. But I just wanted to give you a tidbit of that information, that they will review your food costs, and your whole breakdown at no cost. But like I said, as we get past this moment of time, we can, if you're interested, link you with the guy that we spoke to, and he'll come out and, do a food cost analysis with you. But right now we've told him that we really want to focus on, cleaning supplies and PPE, personal protective equipment. So that's where we are now. All right. Um, so what we want to do now is we're going to move into the next part of our webinar. All right, and I'm going to allow Miss Carla Debnam to take control of the um, of GoToMeeting, and she's going to do a presentation um, with us. Okay, she's going to do a presentation on reentry and how to prepare your staff to reenter. So, Carla, are you ready?
Yes, I clicked on the screen share. Did
Yes.
that?
I'm going to stop sharing my screen. And
Okay.
yeah, I had to stop sharing my screen. Now I'm going to make you the presenter. All right. So now I made you the presenter, and you should be able to
Okay.
share your screen.
Okay.
All right.
I'm sharing the wrong screen. Let's get my PowerPoint up. Okay. All right, everyone. Thanks again for having me in your meeting. I'm going to go over some thoughts that I've had just over this time while we all been quarantined or working from home or still working in the community. Some things that I've come across and that I think would be helpful for you. Um, my experience with Head Start has been really from growing up. My mother was a Head Start grant reviewer for the southwestern area of the country, so I always heard her talking about it, talking about her staff, the people that they serviced as grantees. So I know a lot about Head Start. And as the Renaissance Center, we also had some partnerships in the past providing emotional training support for students and their parents. And so I feel like, I'm already a part of the Head Start family. I have on this first panel, your vision. And I just wanted to help you carry on your vision. And I'll go to the next one. So what's the plan? So if we're going to re-enter into, working in childcare, helping the parents, working in the community, the plan is threefold. So it's going to be triage, which we're familiar with in the medical setting of assessment and looking at what's going on and then going from there. Transition and transformation. So those are the three areas that I like to briefly discuss with everyone. So what is triage? Triage is, like I said, in a medical setting, it would be, going self-reporting, getting your vitals checked, having an assessment, and then following the recommendations of the medical professionals. But triage, and from a business standpoint, is the assigning a priority order to projects on the basis of where funds and other resources can be best used. So I feel like right now, this is where many organizations are. They are trying to assign priorities and resources to what is existing. So while we're also assessing the challenges of being in quarantine and experiencing a pandemic, we also have to work with what we have. So we can't sit by and not, assess, but triage basically is what we've been doing since this started. And since we've been doing this for almost 2 months now, what best practices, can we establish or have we established? What processes, these are things to think about, or priorities that you've had to now come up with as a result of the rapid changes that are taking place. And so I would say, as directors, as staff, we have to be able to turn around the information quickly and accurately. And I think that is part of the challenge, because things are so fluid in this season. So it's like, from a medical standpoint, if my fever keeps going up and down, or the things that I'm reporting, keep changing, then it's going to be hard or difficult to get the assessment I need so I can get the proper treatment. So we have to think of what you're going through as in that same manner, that you're really staying on top of things. And I applaud you for doing that, because you're having to do a lot of meetings like this one, or you're having to do a lot of learning on your own, making sure you're abreast of what's happening. And part of that learning curve is so that you can learn and glean from all these different professionals and establish the best practices going forward. Now, in your cases, you have a governing body that can, you can look to help you, and you have to adhere to certain regulations. So that's helpful. But think about it. These governing bodies, they are in triage mode. They're trying to assign priorities. They're trying to keep up with the information so that they can forward it to your level, so that you can then empower your staff. And so that's still taking place. And I just believe this is going to be where we are, at least for another month or so, where we're still trying to figure this out. So be encouraged when you share with your staff. I think a lot of encouragement to the staff is just being transparent. If you say, hey, we are learning this, we're in this together, we see all the messaging on the news and on television, but it is true, and the staff needs to know you're understand their concerns, and you're working to establish these best practices, you're working to determine priorities, and you're trying to stabilize the processes. So you already have a lot of this in place. It's just that because the situation is so fluid, you have to think on your feet more, and rely on, I would say, your practical sense and the things you've learned, versus pulling out, the paper, the books, and looking at those kinds of things for your information. So while we go from triage, which, as I mentioned, we're still in, and I believe these three things are really overlap. You go from triage to transition. And I would like to just look at transition as we're doing that now, because now we're discussing, hey, how can we go back to work if we aren't fully operational? Maybe we want to get from just seeing the essential, the students of essential personnel to opening it up to other students, or whatever your phase that you're in. The transition, as we heard earlier, is going to be slow in some cases, because of the law, and the recommendations and all the things that have to take place. Now, transition is the passage from one stage, subject, or place to another. And so what that lets you know is that it's multifaceted. There is no one singular way to transition into out the next phase of this. It's going to be different things. And one of the reports I heard recently said that one of the most important aspects of transition is safety. And we just heard about safety. Are we going to have enough supplies to keep the facility clean? Are we going to have to wear masks? You know, what are we going to do about social distancing in, you know, in these normally small spaces that child care and Head Start providers, you know, work from? So safety for the employees, that's their concern. And of course, safety for the children and all the other partners that you have to work with. So that's the part that everybody's trying to figure out now. And that is something, a conversation that has to be had regularly, because once we come up with a plan, if we can't access the cleaning supplies or we don't have the funds to purchase them, if we do know where to get them from, then all those things can be uh, a problem or a situation we have to overcome. And so we may have to adapt. We have to be flexible. It's a book I love by Carol Dweck, a psychologist, called Mindset. And you either have a fixed mindset or a growth mindset. And most of us have both. So it depends on what we're facing. But this is the time where the growth mindset is going to thrive, because they'll be able to go and with transition and look at it from a place of opportunity and not a place of opposition and difficulty. So that's what I would say now. If you've had the fixed mindset of, hey, this is how we used to do it, this is how we're going to have to do it, and even your the persons that are over you might have this fixed mindset. This whole pandemic has shown us that we've got to get flexible and put some things into place. So adaptation is important. Now is the time to develop new processes. So for instance, for our therapy practice, it was face-to-face. We always talked about, hey, we need to upgrade, we need to do something and as far as over the phone or via video conferencing. But hey, we just talked about it. But when this happened, we had to quickly adapt and develop a new process, which was already, you know, out there. So it's just a matter of accessing it. And then we had to make the adjustment to change. So some of the staff said, oh, I'm not doing that. I don't want to do any kind of phone counseling or video counseling. So some opted out of that. Even some of the clients said, hey, I don't want to do that. I don't trust the internet. I don't trust that process. So remember, in transition, as the leader, you may have an awareness and understanding, and you see the vision of it, but it's the communicating of that vision to your staff and realizing that some of them won't understand it, and you'll have to just, you know, continue to offer it to them. These are the options. This is the new norm, and that's what transition does. So transformation. So we triaged, we looked at the problem, we can't come up with some solutions, you know, not 100%, but some things that may work. Transformation is the piece where there is definite change, that what used to be is no longer the same. So we hear about the butterfly, from a caterpillar to the butterfly, right? it's a transformation process. So what it looked like from the beginning is totally different now. And that's what's going to happen, I believe, in a lot of areas that we used to say this was the only way to do it. Now we've had to turn around and turn over and do some things. So once we get past the sanitation, the social distancing, if we get, everything is clean, we assure our parents and staff that the places where their children are going to be suitable for learning, then we have to still realize that even if you follow every regulation, every guideline, it does not mean people are going to accept it and come. And so we'll just have to continue to encourage people. And that's a part of it, because the changes have already been made in some areas. Some are going to be permanent changes. So for instance, like with the counseling, some people love this way of counseling, so they want to continue it. They may not want to go back to face. And now we have that option. And so that's what it's going to have to be for learning. If you've had to do the learning via the internet with some of the students, or well, now everybody, that may be an option for some going forward. Now we know that's not ideal for a lot of reasons, but that may be it. So what has been created due to the changes? So you have to look at the positives of the changes, even though you've had to adjust quickly, make some new things happen, but look at it, with the growth mindset and some of the positives. We also have to live in the new normal, or as one person I heard say, the new abnormal. And that means things will look different. And if we work on adjusting as leaders, then when our staff and the parents and the children encounter these changes and we have a positive mindset on it, or have adapted our mindset and shifted, then we can communicate that to them. And when they encounter the new normal, they'll feel more comfortable because they trust you as a leader. And one of my family members is in healthcare administration. And so when this first hit, all of the administrators said, oh, we're going to stay home. But they sent all of the frontline people out there, the nurses, doctors, aides, and phlebotomists, and all these people. But they decided, hey, I need to go into work, because they need to see their leadership is with them. They don't just need to see the leadership is at home being safe while we're, out here, on the front line. And so that's going to be a part of helping the transformation take place, is knowing that they can count on their leaders to be present, honest, and authentic, as far as, and really care about them, because that's what it's going to take. Also, looking into some of the things that have been considered innovative ideas, and now you might be the time to implement them. Things that, like I said, were on the back burner that you have been looking at. If you have the resources, you might, want to start thinking about that. So our focus is the children. So what about the children? We have to think, what shape will they be in, when they return? They'll be in a lot of different places because they haven't seen their friends. We're going to have to address, some of all of those things. And since they're kind of used to it now, it's just that we just have to keep educating the parents, educating the staff, and just educating and reassuring the children that things will their new norm. We might not going to say we're going to go back to what we used to do, not for a while now, is what it looks like. We need to meet them where they are. And when I say them, and I said, what about the children? But that's the staff, the parents, and the children. As leaders, we're going to have to say, everybody's not going to be on board. We're going to have to say the same thing over and over and re-educate and be patient with the children, the staff, and their parents. And that's what I would say. It's just going to take patience and understanding and knowing that you have to say the same thing and not threaten people. I've seen things on Twitter and Facebook where people are threatening their family members that if you leave the house, you can't come back, or, if you don't adhere to these rules, all these kinds of things. So we don't want to threaten. We want to encourage. We want them to know that we are doing these things, have these things in place for their safety and the safety of the children, and that when we can do things differently, we will. But right now, this is the way it is. And part of a growth mindset and just life is, can you be flexible with your expectations? So for instance, my family member, that first week when the administrator stayed home, most of them, but some of them did come to work, people quit, because they're in healthcare. They didn't know, it was no guidelines. Remember, it was the beginning. Everybody was upset. So people quit, then called out of work. They did all kinds of things. And so in her case, she had to be flexible. How am I going to assure my staff that it's safe to come to work, and how am I going to assure the patients that it's safe to come here for health care? And so you have to be flexible and ask yourself, can you be flexible and patient as this process, returning back to the new norm, not the norm. We're not going to go back to the norm. And that's what I have to tell myself, and I would like you to know. So we're not going back to that. So I just want to put up quickly, this is called the life events checklist. And I put that up because a lot of these things, some of them don't apply to us, and some do. But now a lot of people have lived through things that they never thought they would live through. We're all living through this again together. And so when we have these things, our children that you service have had some of these issues in their lives. You've had them, as well as their parents. Consider this, that we've all been exposed to trauma. This whole experience is traumatic. It's not little t. It's called sometimes. This is big T. It's a pandemic. And that's what I keep telling myself if I'm out of sorts. And you need to be telling yourself that and assuring yourself that it's okay to be out of sorts. Why? Because we're living through a pandemic, something we've never experienced before, and something we'll never experience again on this level. So that's what you have to tell yourself. So keep flexible. This, we'll share this PowerPoint with you, but remember that we all have experienced trauma and are making adjustments. Any questions?
And I am unmuting people, so if you have questions, you can feel free to ask a question. All right. Okay, so and if you think of questions later on, you can feel free to email me. I would like you to think about, Ms. Dednam, just ask the question, can you be flexible? Now obviously we're Head Start, there's a lot of requirements, and there's going to be a lot of things that we cannot be flexible with, but where can we be flexible, especially as we're looking at our staff and trying to help prepare them to be ready to return and have their mind state so that they feel comfortable coming into the programs, and looking at some of the issues that they may be dealing with as it pertains to child care, income. They may still be working with Head Start, but they may have a spouse that has lost income. So, how can we be flexible to make things comfortable for our staff when they do return to the classroom, and the fears that they may have returning to the classroom, and some of the things that they've dealt with throughout this entire ordeal. So I think that's a really good question that you've got to ask yourself is, how can I be flexible where it's permissible?
Correct.
And thinking about how my staff, the children, the families, how they've been impacted by this entire thing. So I think that's a just a great question, and for you to have in your mind as you're looking at reentry, and we're attacking some of the issues that are going to that we're going to inevitably deal with as we reenter into the program.
Mm-hmm.
So, okay. Ms. Devlin, I thank you very much. And if you could send me the slide, I will send it out to people, because I believe that last slide a lot of people may be interested in. Okay.
Yes. Okay. Yep. I'll definitely send it out to you.
All right. Thank you very much. Really appreciate your time.
You're welcome.
All right. Okay. And ladies and gentlemen, I think Yvonne, I'm going to bring you on. You said you wanted to share something with the group. And then I know time is running low, but I'll bring Yvonne in so that she can share something with the group, and then we'll wrap it up from there. Yvonne, I think you got to unmute yourself if you're able to.
Yeah. Am I unmuted?
Okay, there you go. Yep, you're unmuted.
Good afternoon, everyone. I'm glad to see everyone here joining us. And as Janine said, we've been meeting with people virtually and talking. I just wanted to update you a little bit on the ECE work group. Tressa's part of that group, also with me. That is the group. I think it's happening all around the country. The group got started in 2015, and then it kind of died down. It's something that the Governors Association is doing, and they're looking at raising not just the qualifications of people who come into child care or Head Start, which we already know we have raised qualifications by the Office of Head Start, and also to increase pay, because you cannot continue to ask people to get more education, but yet cannot pay them. So I just want you to know that work group is still going on. To me, it's almost like there's 3 different missions going on in this work group. One is how to market and advertise early childhood education as to raise the standard among people, that people see this as the profession we know it is, and that's one thing, because once you get the community viewing these professions as important, needed, that helps raise all tides. So that's one of the focus. Another focus is, of course, money, and how that comes down from the legislators, how it comes down for us from the federal government. So they're discussing that too. And one of the third things is, how do we make the education accessible to everyone, especially people who are already working in the industry that maybe have their 90 hours or 45 days coming in at the entry level? And how do we assure that they can continue to get the education and not have to sacrifice their jobs at the same time. This is definitely something we talk about in Head Start all the time. Just like the beginning of last year, Timmy and I went and met with them in Frostburg at the Frostburg University, and how their program works and how they include Head Start as one of the places their teachers go to get their degree. How do we make that happen in Maryland also? So just wanted to let you know that that work group is still going on, that we have not lost our focus on that, because whatever our new normal is, the one thing that will still be normal is we need people who are teaching and working with children. And so that we had a meeting yesterday. We had someone that came in, and one of the big questions they asked, it was about setting goals and things. And there was a presentation from Coppin, with Coppin, and I just emailed because I don't see the documents in the shared work group, so I'll also send those out. Coppin has developed a program also, but it's not one. Coppin has a program where they are in partnership with Frostburg, but they developed another program that is online, and this program is more for people who want to go into childcare or get certain certifications. The only thing, the question that kept being asked about this one program from Coppin is, does it transfer over to a degree? And I think the answer was no. Does there still some value in it? Yes. But who is this a value for? So we'll get the information and send it out, because that could be for a parent that's looking for this as a career path or whatever. But just want to know, we're still working on it. But one of the questions she asked the group, and then we broke up into little work groups, pretend we got everything accomplished, what would it look like? And that was a great question, because like even in data, we always look at what we want it to look like at the end, and then we build it. We don't start building and then later figure out what the outcomes are going to look like. And so they were talking about that in the work group, in the different work groups, and then we shared it. We had a little technical difficulties, so we didn't get to finish everything. But just want to let you know that is still going on, that we are still looking at these things and entering in discussions. And there may be time I might solicit some things from you guys based on what they're talking about in the group or what we have to bring to the meeting. But I think that's a great question. If everything was the way we wanted it to be, with a career path for people to get their degree and to make sure that the community then and the legislators respected early childhood education, what would that look like? Because when we can figure out what it looks like, then we can even define our path to it a little better. So I just wanted to update you and let you know we haven't taken our eye off of that, and we're still participating in the work groups. And like I said, Tressa's in that work group too. I didn't know if Tressa wanted to add anything to what I just said, but we're definitely keeping our eye on all the priorities we had before the pandemic stepped in and sort of kicked us to a side range. So, yeah. Does anybody have any questions? Or we can invite somebody to come to the meeting with us. So if anybody's interested in, I had talked to a couple of people about being my backup, especially when they were doing live meetings. If anybody wanted to join me or be the backup for times I couldn't attend, please let me know. Because definitely Head Start's voice needs to continue to be in this conversation. That's it, Simeon. And everyone should have gotten the POY applications that came out this morning. I'm sorry for the delay.
And that's the Parent of the Year nominees or honorees. Yeah. Okay. Thanks, Yvonne. I'm sure I'll talk to you a little bit later. Are there any Is there anything that anyone would like to share? Any feedback? Anything you'd like to share? Any questions? Um, Tracy asked, have there been any further guidelines released regarding the Head Start summer or COVID funding opportunities? I have not seen any other guidelines. I thought Teresa said when we were on the last call that she'd gotten an email with some updates from the Office of Head Start, but I didn't see that document. Teresa, if you could send me that document, because I didn't see the document anywhere. But there haven't been any other guidelines that were released for the Head Start summer funding, at least that I'm aware of. And I've been looking and asking and emailing people about these updated guidelines, but I have not seen them as of yet. So if anyone does have them, please send them to me so that I can distribute them to everyone else. I do want to give you a small update about the campaign that Region 3 Office of Head Start is implementing called Return Ready. At one point, it's going to be virtual, and they were a little shaky about getting a platform, but it looks like they're going to have a platform and it's going to move forward. There's no set timeline for it right now, but be prepared to participate in it. It's going to be called Return Ready, and it's going to be all about transitioning back into the classroom. All right, so that should be a really good a forum for everyone to kind of gain some knowledge and share some knowledge as well. All right. Any other questions? Any other questions? I did want to ask, and you can email, you can answer me here. You can put it in the chat box, or you can just email me. How are things working with your policy councils? And does your policy council need any kind of any training or professional development with this whole thing that's happening? Have you been in contact with your policy councils? Have you been able to meet if you had scheduled meetings? And if not, please make sure that you are documenting everything as to the reasons why you were not able to meet, if you were not able to meet. And this may be a time that you encourage your policy council chairs to look at the bylaws just in case you do not have amendments in your bylaws, or you do not have things in your bylaws that talk about these type of emergency situations and how you would meet during these emergency situations. What would happen if you didn't have enough people there to vote, if you didn't have a quorum, those type of things. It's a really good time to look at your bylaws and start to discuss amendments if those amendments need to happen, to make sure that you have them in place for the next time. Just like in this training, we talked about developing new processes. This may be a time that you've really got to look at it and figure out, how do we prepare in the event this happens again, if you don't already have it in your bylaws. So, it's something that you may want to look at, and, it might be something that Yvonne and I, we can discuss it. We can, do a training with your policy council members on some of these things, if that's something that you think you need. All right. So please, if you have any other questions, I'll give a couple of minutes. If you have questions, you can put it in the chat box, or you can just ask a question. I do have people unmuted. Everyone is unmuted. You can just unmute yourself if you need to, so that you can ask a question. If you do not have any other questions, and like I said, I'll give a couple of minutes. I will bring this one to an end, and we'll pick it up next week. And, I do plan on having someone else, another presentation next week, amongst other updates. So we really appreciate you all being attentive, coming and joining us, participating in these meetings, because there's a lot of information, and we're trying to be the source that brings all the information together. So if there's anything that we're missing that you need, please let us know. All right, so that we can make sure we're bringing it all together for you. And we'd like to be able to open this up so that you all can share a little more. And, it's like we're worried about our staff and our families if they are feeling any pressure or dealing with some things. We all are dealing with the same issues. So this is a forum where we can share and try to get some help and support from each other. But other than that, if there are no questions, again, feel free to email me, please. You can take a look back at this video. I'm going to send out notes of the meeting and the video. Please take a look at those updates from the Office of Head Start. Think about your policy councils if you are meeting or not meeting, or if you've had problems reaching out to your policy council. Think about ways that you can reach out to them. Think about your bylaws, or have your chair think about the bylaws, and the executive committee, thinking about those bylaws. And then, of course, ask yourself, can you be flexible with everything that's going on, and with staff, re-entering, children re-entering, families re-entering, when that time comes, as much as it is permissible, how much can you be flexible to help everyone get transition back to whatever our new normal is going to be. So, ladies and gentlemen, I thank you. I appreciate you. And as always, I'll be in contact with you throughout the week. Information that was in here, documents that was in here, I'm going to send it out with the notes from this meeting, and I'll be in contact with you throughout the week. All right. So thank you very much, and have a great rest of your day.
Thank you. Bye, Sharon. Bye,
Thanks.
everyone.
Thank you, Simeon.
All right. Thank you.